me get my own thing sorted out. Ah, okay.
Being invisible. I'm very happy to welcome everyone to the fourth session in our personalized medicine group. And I'm very happy that the series is continuing this academic year as well. And I'm delighted to welcome Carolina Snell, who I believe will be a wonderful next speaker in our series. And Carolina, for those of you who don't know her yet, is a sociologist by training. She's at the University of Helsinki, and Carolina is really one of the key people in the Finnish personalized medicine scene. And it's remarkable that as a social scientist, she's part of the inner circle, which is sometimes, as we all know, sometimes a difficult endeavor for social scientists to be in this position. So Carolina has a science and technology studies background. She's involved in a number of projects on genetic databasing and genetic testing. And her current work, among other things, is dealing with the tension between the Finnish healthcare system being one that is established according to solidaristic principles and has quite extensive health records and data capture, and that interestingly makes it a very interesting and desirable asset for also commercial endeavors. And today Carolina will be talking about the establishment of a Finnish National Genome Centre, and she will talk about citizen and policy perspectives. So thanks, Carolina, for agreeing to talk to us today.
Okay, thank you very much, Barbara, and thank you, Imogen, and everybody for inviting me to do this. Yeah, good afternoon, everybody, and well, good morning, whatever time it is for you. For me, it's afternoon. As Barbara said, I'm going to talk about a project that's going on, which is building a national genome center in Finland. And first, I'm going to sort of talk about what this planned genome center is, and then introduce some other ongoing policies and legislative reforms that make the picture more complicated. And then I will introduce some of my research results on what Finnish people think about using their genome knowledge and the establishment of the Genome Center. So the Genome Center, I'm going to shortly say what it is after first explaining that last year, 2016, Ministry of Health and Social Affairs set up a working group to sort of define the functions of a genome center, what the genome center is, and also to draft a law, a genome act. And I'm part of the working group, so I've been closely following what's going on and also participating in it as a sociologist. And this is very much work in progress, so it's quite difficult actually to yet say what the Genome Center is, because it's still as something in the making. But what we know about it, what the National Genome Center will be, it will be a national genome database. So the idea is in the future, all of the populations, Finns or people living in Finland, all of their genomes will be stored in one national registry, one database. But it's not like only one type of genome data and only one type of database. It will comprise of different type of databases, reference database, variation database, even perhaps cancer genome and other omics data. And this is still sort of in progress, what kind of data it will comprise. And where does the genome data come from? It's planned to come from various routes, from healthcare, from if you get a diagnosis and a genome analysis is done, it will be stored in the Genome Center, but also through biobanking and other research projects. So there are several routes for the accumulation of the genome data. And the idea is that the data could be used in the personal healthcare of the person who has given the genome data, but also in research and development. So funding for the project, sort of a seed funding, is coming from the government of Finland. The Genome Centre is one of the key activities, but it's work in process. As I said, the goal is that the act, the Genome Act, that has to be made first, because it will be a national registry, and you cannot have this kind of big registry without legislation. So that should be passed next year. And the goal is that the Genome Centre will be established by 2019, which is rather fast. Okay. So, but it would be quite simple to talk about just the Genome Centre, but the Genome Centre is only one of those places where in Finland it's now planned to store health data, to centralize health-related data, and to make it easily accessible to research, development, and other users. We have, of course, biobanks. Currently in Finland, we have 10 biobanks, and we know the exact number because what is a biobank is defined by our Biobank Act that came to force in 2013, and all biobanks have to apply for a permit and be registered in a biobank register. So now we have 9 publicly funded and a new first private biobank in Finland. So why this is sort of a complicated is because biobanks are seen as the main route, at least at first, for the genome data to be accumulated and gathered in the Genome Centre. And this has been puzzling to Finnish biobanks because they have invested very much in the genome business. They have invested in expertise and how to handle, store, gather the genome data. And now all this is sort of the idea that all these will be the responsibilities of the upcoming Genome Centre. So this has raised concern in the Finnish biobanks because it's seen to like it could jeopardize their core functions and also business logic of these biobanks. So there's very much constant contestation about the division of labors between this Genome Centre and these established biobanks. Well, even this could be simple, but it's part of an even bigger picture. We have now legislation on secondary use of health and social welfare data, and it's currently just now being debated in the parliament, in the constitutional committee. So it's not yet passed this law, but it's in the parliament discussions. And the idea of this legislation is to, first of all, build up one permit authority and service that through which researchers, companies, managers of health information could get access to almost all health and social well-being data gathered in Finland in public registers and public healthcare, public social services. Also partly in private healthcare too. So there's now going to be, if the law is accepted and implemented, one authority through which all of these data could be accessed. And you can see biobanks and genomic data there in this picture in the left-hand bottom corner. It's only one part of this huge data structure. So this has raised again concerns with biobanks who have been sort of in Finland already trying to be this one permit authority and one service point, one-stop shop, as they call themselves, because they have been the ones who have been combining genomic data, health records, and registers. But the new law actually requires that biobanks, when they need to combine data, even they have to use the permit authority. So this complicates the functioning of the biobanks even more. And so the new Genome Centre that's being established is part of a bigger picture, and it's trying to find a place somewhere, but it has already funding, so it needs to be somehow established, but it's not very easy to find the real niche for the Genome Centre. Okay, let's take the next slide. So what makes it quite interesting is also the idea of informed consent or consent practices. Because this is a very complicated picture. We go a little back to the Genome Center and the discussions we've had in the group and elsewhere. Do we need to ask for consent, first of all, to store the genome data in the Genome Center? Not yet talking about the secondary uses, but first of all, to store the genome data. And as I said, the data is coming from different routes, from biobanks, from healthcare, and from research projects. So there are different types of consents also. The Biobank Act in Finland defines that biobanks in Finland have a wide consent. It's a consent that needs to be always asked, but it's wide, so it can be used for various purposes. But this means that if you ask for a consent of people, there has to be at least a mention of the option of storing the genome data in the Genome Center. And some have talked about that there needs to be maybe perhaps an even option to choose whether you want to store it in the Genome Center. But the problem is if you don't want to store it in the Genome Center, that will be probably interpreted as a rejection. You don't want to participate in a biobank because that probably is the only option where to store the genome data. But all biobank data is not collected with a consent. Prior collections in hospitals and, for example, in the National Institute of Health have been transferred to biobanks, not with consent, but with notification procedure. So pre-2013 collections have been transferred, and there has been the notification procedure means in practice there's an ad in a local newspaper. And if you see the ad, you can opt out. But if you don't see the ad, you don't know that your tissue samples, for example, are being transferred to a biobank. Okay, so there are two different ways of consenting already with biobanks. Then there's healthcare data. If the genome data is generated in healthcare, now the idea is that it could be more or less same thing that other patient data, which is stored in the patient records. And in Finland, every patient records is automatically stored in our national archive called Kanta, and you're not asked for consent. It is automatically stored there. So now the idea is that perhaps genome data could be similar kind of data. It would not be stored in this Kanta, but it would be stored in the Genome Center. So no consent would be asked. You could perhaps opt out. And then there are separate research projects, and research institutions have sort of their own consent procedures. But it's not clear that if you, for example, participate in a clinical trial or some sort of research project, that your genome data generated there will be stored in the Genome Center. So that's still a question. But anyway, what this means that there are different routes of gathering the data. So there are also different types of consents. And some people, if we look at this sort of picture, some people would be asked for consents and others won't. So this puts people in a very different positions. Some people would actually know that their data is being stored, and other people might not even know that their genome data is being stored in the Genome Center. But, okay, this is even quite easy, but when we start looking at the secondary use, what will be done with the genome data? And one also other aspect that makes this more complicated is, of course, the new European Data Directive that puts very strict guidelines for what consent is. And talking about biobank consent, we have this wide consent defined in our Biobank Act, but some have now interpreted the EU Data Directive so that it does not allow for a wide consent. And this was a rather prominent interpretation in Finland for a while. Now it's also been contested. But it was thought that because we have already legislation concerning biobanks, we cannot have a overlapping two sort of routes for gathering the data. So they thought that, well, we cannot have consent. Also, there's been some problems having enough consents in biobanks. Some biobanks have sort of have only like 30% of the consent rate, and this has prompted also discussion about, okay, do we really need consent?
No, I can't hear it, but it might be.
Finnish people are regarded as being like very optimistic about science and willing population. This is the rhetoric as it is. So it's been suggested that we don't actually need a consent. And biobank data could be interpreted as a register-like data that is gathered on the basis of law, and no consent would be asked. There would be an opt-out possibility if people knew about biobanks, and my recent survey shows that only 50% of Finns actually know that there are things such as biobanks. So, but now there are many biobanks and other people who say that this route is not the one to be taken, that we should somehow find a route to have the right consent. So this is still being debated. Okay, but then we start thinking about all this picture I had. Let's have a look back at it for a while. This was this complicated picture where we have all these different registers and data sets. We have this Kanta, which is the patient records. We have biobanks. We have data from the social welfare sector. So how do we make sure that we don't have conflicting consent options, for example? So this secondary use of data legislation tries somehow to make the consent practices compatible and simple. And for me, the problematic thing is that it is quite easy to interpret that, well, the easiest way is to get rid of consent. And this has been well, sort of some stakeholders see this is the best option, others don't see it as the best option. But how different, like how can, for example, Genome+Centre have its own consent procedures when there is this one permit authority that is even on top of it? So now there's debating going on. Can different register keepers have different sorts of consent procedures, and how can these be combined together so actually research and development can be done? And it's a very complicated picture, and no real good answers are yet available. The secondary use for social and health data legislation, the first drafts had no real consent practices there. But now there are like mentions that if the data could be used for example, commercial research, a consent should be asked, or the data should be anonymized. So what this means is still quite unclear. Okay, so this is what's happening in Finland. And when we look at the citizens' perspectives, what do people think about this? I've done 8 focus groups this year on uses of genomic knowledge and on the establishment of a genome center. I had sort of a different compositions in these groups. I have mothers of small children, I have teachers, students, unemployed people, even recovering addicts. And so it was, we were looking for like wide views, different kind of voices. And it was in 4 cities in Finland, from Helsinki to north in Oulu. I've done also previous focus groups where I've discussed with people about biobanks, health data, and genomic risks on expectations, concerns, combining data, of course, consent and control. And why these focus groups are very important is that there's very little public discussion in Finland on these subjects. Biobanking, no, not really. Uses of genome data, not really. But recently, there has been some discussion on the secondary use of data, some more critical voices. But so this sort of a focus group research seems to be the only way to gather, well, not the only way, but an important way to gather people's opinions on these issues. So, as I said, I will now focus perhaps only on these consent issues, because there are different aspects and ideas that people have. But for most Finns, consent is a precondition for using their data. Finns are very enthusiastic about research mainly, and they want to support it. They want to support development of medicine, and are even positive about giving their data for research purposes, but would prefer to be asked. So it's not like, yes, you can do everything with my data, I don't care. Some people say this, but most see that at least they should be asked for permission. Others want to have much more closer say on what purposes, who gets to use it, what could be done with it. But this is not only with research and development, also people are very they think that also in relation to healthcare and their own care, consent should be asked for using their data. So only on need-to-know basis could their genome data, for example, be used in healthcare. And they regard very important that when genome data is gathered in one centralized database, there should be this should be very well communicated to the people, and beforehand, before this center is established, before the data is being transferred to the genome center. And this is something that with biobanks has gone, to my opinion, a bit wrong, because collections have been transferred to biobanks and people really do not know about it. And they see that the operations of this genome center should be transparent and serve common good. All this is very, we all know that people more or less think about it in these terms. And they want to control their data, some very much, but most are also preparing to give control to the trusted public institution, which means National Institute of Health or universities or publicly funded researchers. So they have a trusting relationship. So they don't want to control each and every single aspect. But most worries, and again, this is not news, most worries are related to commercial uses of the data. People are skeptical about industry, companies doing business, as the benefits are not seen to return to themselves, to the Finnish healthcare system, or people in general. Only some people would benefit, and business is also seen to lead perhaps to unethical things. So this is quite clear, but when concluding this, when we look at the system, the health data system that is being built in Finland, and it's being restructured to meet the demands of international data economy. So what people are expecting and wanting is to sort of have control and understand where their data is being used, and the system is actually more or less being built to serve many purposes that are very unclear for people. And with biobanks, genome center, the secondary use of data, there are many other parallel systems going on. There's a cancer center, neuro center, all sorts of centers that collect data and aim at disseminate it. They have all different practices, and it's quite difficult to implement the various ongoing processes and projects from the viewpoint of consent. And as I said, an easy solution offered is to consider genomic data, biobank data, and other data as a registered type of data. And because this is sort of some data that has been gathered in Finland for decades, for hundreds of years even. So it's something that is more or less familiar to people. So because of this, and because quite often consent is seen to hinder research and development, a presented idea is that genome data would be like registered data that would be gathered on the basis of legislation without consent, but with an opt-out possibility, perhaps. So while people support research and medicine, they would prefer consenting. So this is a sort of a contradictory thing. And other contradictions that emerge are that people are worried about this commercial use, and all this framework that is being developed, one of its main aim is to attract foreign investors, to attract international business to use Finnish health data. So these are my thoughts. I thank you, and I'm ready to take some comments and questions.
Thank you very much, Carolina. So the floor is open. Do we have questions for Carolina? And then I'll start off with one. I have many, but I'll start off with one. So first of all, thank you very much. This was very, very interesting also because there's nothing published on this yet. So we are this exclusive group who has access to this information already. Carolina, you said an option that is being considered is to do away with consents. But you also mentioned that the new EU data protection regulation wouldn't make that possible. So I'm not sure I understand how the people responsible are considering to implement the idea of doing away with the consent requirements.
The argument is that because it could be framed, because we have such extensive regulation, the legal framework, if everything is already in the regulation, that this data gathering and using it is done for sort of a public good, for public health, etc., then you don't need to have consent. And I think this is something that the EU data directive makes possible.
You mean the regulation, the new regulation?
Yeah.
Okay, so that would be the research exemption then.
Yes. Yeah. And this is something that is being sort of a thought that it could be widely implemented to most registers and all this sort of information. But this is also contested. Not all in Finland, or not all lawyers. There are mostly lawyers who are sort of arguing about this. Not all see it this way, but this has been presented as an option.
I don't know if you can see, Carolina, there is a message from Mohamedou Diakite from Mali at the bottom of the chat. Can you see that?
Any specific requirements for Africa where we are dealing with multiple ethnic groups? So what is the question really?
I can't see. Hold on, let me just see if I can unmute Mohammed. Let me see. Here we go. You're not muted. We can hear you very quietly.
Okay. I was wondering if in Africa we are dealing with many ethnic groups. In terms of a biobank, do you have any comment?
Yeah, the Finnish situation is quite peculiar in that sense that the Finnish population is very much framed as a sort of a unique and unified. We do have a very sort of a unified genetic pool, I would say, but not as unified as it's sort of advertised, because of course we have different sort of populations and we have some minorities here, but this is something that is not being discussed very much in the Finnish policy and strategies, and it is seen as an advantage, a competitive advantage for Finland, because we have sort of a population that has come to Finland, and through bottlenecks it has very sort of a unique characteristic genetically, and it could be made that would be, you can find some characteristics much faster in the Finnish population than in a sort of a more varied population. So we are not really discussing sort of a different type of populations, ethnicities, or even race, and to me that is quite problematic and should be also discussed, because of course in Finland we are different sorts of people coming from all over the world, and these are not considered really sort of different things in here. So it's quite different from, for example, I know from Singapore, where biobanking there is seen as like, okay, we have the whole world in here. In Finland, we don't have the whole world. We only have Finland here.
I hope that answers your question, Mohammed.
Yeah.
Okay, fantastic. I see Shamila has a question too. Did you want to say that, Shamila? Oh, sorry. Or do you want me to say it?
Doesn't matter. Hi, can you hear me? No, I was just curious whether you have heard or people have already proposed locally in Finland anything as an option to those who worry about commercial uses of such genomic databases, because this is a worry we have here in Brazil.
Yeah.
Thanks for the talk. It was very interesting.
Thank you. As I said, we really don't have really much like public discussion on this. So it's very much expert-led discussion done in the working groups, done on the sort of a ministerial level, strategies, etc. So we don't have like very active or top-down ideas on any new ideas. We have some active patients and patient groups, but they're more or less very much on the same line as is the sort of national strategies. So not really, we don't have like solutions. Then of course we do have different types of ideas of trying to implement dynamic consent, my data, etc. But somehow these are quite separate discussions, I would say, and it's quite difficult to combine this sort of a automatic registered type data gathering and then the empowered people who can make choices. And these discussions are quite difficult to have in the same table.
Thank you. I know Kazuto, hello, welcome from Japan.
Hello.
Thank you for being up so late. Also has a question regarding the Genome Centre.
That's right, yes. Hello, Carolina.
Hello.
Very nice to meet you. I'm from the, well, not the other side of the world, because we are closest countries between Europe and Asia.
True.
Yeah, and so it seems many things are going on in Finland, and very informative. Thank you. And my impression is that the Genome Centre is the newest activities, but so you have different purposes of different people. So what is the Genome Centre aiming at?
The Genome Centre is aiming at, well, first of all, to provide sort of these databases for research. That is the sort of the one thing. Reference databases, variation databases.
Yeah, I see.
Yeah.
But those you had explained in the slide. But
yeah.
Is it to implement genome medicine, or is it to activate pharmaceutical companies, or all of them together?
Yeah, it's all of them together. We had a genome strategy that was made beforehand. It was published in 2015, and it has sort of many elements. One of them is to sort of implement personalized medicine, and this genome data and sort of a route back to the clinic is a very important thing. Try to be established in the Genome Centre. So how can the genome data be used in the personalized medicine? But of course, this is the sort of requires more work. So the first thing that will be done is the establishment of the databases and making them easily usable for research. But the main idea with this Genome Centre and all of them, which are sort of very much part of this bigger strategy of health sector growth strategy, which is really aiming making Finland a competitive country, the best test bed in the world, as it is said in the strategy. So to attract pharmaceutical companies, to invest in Finland, to do research on the data, and also sort of somehow as they come here and use our data, they will also develop infrastructure here, perhaps, and new businesses. So this business logic is very much visible in this whole.
Well, okay. Follow up. One thing we noticed all over the world, including Japan particularly, is the sort of different activities in research side, including biobanks, and also implementing in the clinical side. Although they are connected, but still things are so diverse, and you need to do so many things. So recently, implementation has more emphasis, and so although the government is supporting both activities, clinical activities and research activities, but we see it as a sort of slightly different activities. So I'm curious how your country is combining the two or doing things differently.
Well, I think the problem of sort of a translation, as it could be said, is very visible all over the world and also in Finland. And the biobanks were first thought of as being the tool for translation. But actually the legislation with biobanks went a bit wrong, and it didn't sort of allow the direct route back from biobanks to clinics that was sort of expected. So now the Genome Center is a new intake on this, that through the genome data, all this research could come back to the clinic.
So maybe we can sort of generalize the biobank days and precision medicine days. And precision medicine, the implementation of genomic medicine is coming more recently everywhere in the world.
Yes.
And the biobank is a bit of sort of already ongoing activities, but in fact struggling to catch up the change happening in the implementation side. Thank you.
Thank you, Kazuto. I know Isabel has very impressively used the hands up option. So let me welcome you in.
Thank you. I was just checking whether it worked or not. No, but thanks. It was very interesting to hear from Finland. And there's something that is absolutely fascinating when listening to you is that apparently the rhetoric that is used in Finland for developing a genome center is exactly the same as the one that is being used in Norway for developing a health data analysis platform, or that is being used in Denmark for developing a national platform for data. So it's very interesting to see this phenomena that all countries are developing the same strategies and with the same arguments. And also this is very often from my perspective, it looks to me that this is very often a top-down approach, that the politicians are very much driving this, maybe also with the research community. I don't know what it looks like in Finland, but my impression is that it is very similar to what's happening in the other Nordic countries. But what I wanted to ask you is that the way you were explaining this, it seems that this is almost as a trade-off, that the citizens have to give away their right to consent, more or less, to make research happen. And research, of course, has some public health implications, hopefully positive public health implications. But are there discussions to see, in a way, what's in it for citizens? Kazuto was mentioning that something should be transferred, or the results of research should be transferred back to the clinic. So are there any specific plans for returning results from research to the clinic, so that the Finns can benefit from, in practice, from the results of research?
Yeah. First of all,
I'm thinking also at an individual level. Sorry for interrupting.
Sorry, me too. First of all, it's wonderful because on the Nordic countries we all have this national treasure, we have this
Yeah.
gold mine,
Yeah, yeah.
we have whatever it is called, we also have it, and then we also in the Nordic countries, it's like, okay, we should do something together because we are two small countries, but we're still competing with each other of being the best genome country in the world, for example. Yes, and I'm painting a rather dim picture of the consent procedure, but as I'm trying to influence it myself, and there are of course other discussions going on, I'm hoping for that the consent will be still part of these systems. And for example, in the biobank community, there are many actors who see that, okay, we need consent. This thing is not possible without consent. And for example, big pharma also requires consent, so we need consent. But I'm not sure what's going to happen with this. But when regarding giving something back to people, there are various projects going on, pilot projects and efforts to to try to return research results. And this is something like in contradiction to like for the Iceland case where that is not possible. Now the Biobank Act already said that you can, the effort was that biobanks could return easily research results to people, but this was not possible. So now the Genome Center is the way to see that something would be returned to people, either via clinic, but also personality through this, for example, this, as I talked about this Kanta, this national patient record archive. So it would be a possible way that you could have research results, genetic analysis, all sorts of things that you could access through this national archive, where you also have your personal access. Own Kanta, my Kanta is something that's being developed. So there are many ideas of to return specific genomic analysis, secondary findings, but also maybe risk analysis for getting a cardiovascular disease, for example. So lots of things is happening in this front. There are mainly rather scattered projects going on, but these are somehow thought that these could be part of the big picture, returning research results, returning knowledge back to people.
Can I have a follow-up question on that? Is anyone investigating the views of clinicians on this, of providing feedback to patients?
I did a small interview related to a project where I think it's now 8,000 Finns have received a risk score for getting a cardiovascular event during the next 10 years, and it's partly based on the old lifestyle factors, but also on a it's called set genomic risk, but it's like 40,000 SNPs or something. It's really a huge part of huge genetic data. And these people were receiving the information themselves. So I've been doing focus groups with these people, but also interviewed doctors about, because they said this would be also in the decision support system for doctors. So they could see their patient's risk score. So I interviewed some doctors, and they were more or less skeptical about the uses of this. But of course, this is like getting a cardiovascular event, and most doctors said, well, you can see if there's a risk when the patient walks in. If he or she is overweight, there's a risk. So it didn't bring anything that new to the doctors. So they were a bit skeptical, but on the other hand, they were maybe waiting for some really useful results, maybe pharmacogenomics, for example, or something like that, that they thought that could be useful in their work.
Thank you, Isabel. I know Barbara has raised a hand.
But I'm happy to go last if there are other colleagues.
Anybody else? Nobody has raised a hand or made a comment, so go ahead.
So Carolina, do I understand correctly that it's not currently foreseen that that people whose data are stored in the central genome database will be able to download their raw data? Is that correct?
Well, it's still being debated. whether they could actually download the data, and whether actually if they've done some 23andMe or whatever, could they also upload personally their data. And this is being debated with the quality issues, etc. But there will be, I would say, there will be some sort of a way either to download the whole data or then grant an access for whatever service provider to the Genome Center and your data where it's stored. So if you want some company or service provider to do analysis on your data, you can grant an access, and they will do it, but it still will be stored in the Genome Center. This is one option that is being thought of. So no, no sort of a clear solutions yet. This is still being sort of considered how to get a sort of a is it actually can a sort of because this will be a public institution that has sort of a responsibilities. Can it just give the data to people to do whatever they want with it, or should it sort of create a list of sort of a good service providers that can have access? If it's something like, well, we have in Finland like this unicorn things or magnetic treatment or whatever, so it's like really something baloney, you would not be able, the company would not be able to access the data. So should the Genome Center actually keep list of companies that actually do good work with your genome?
Very good. Thank you. You happy with that, Barbara?
Yeah, yes, thank you. Very interesting, thanks.
I know SB46, I'm sorry, I don't know your name.
Sorry, Sarian.
Sorry, it's
Sarian.
Hi, Sarian.
Like Marion, but with an S. Hi. It was actually just a comment on that previous point, because the new data protection regulation has a new data subject right in it, which actually is about data portability. And researchers, so personal data and data controllers holding personal data are required to be able to give data in a compatible, in a usable format to data researchers. And I think, I'd have to double check, but I don't think there's an exemption for researchers from that data subject right. So is that something, I mean, obviously there's a question about whether pseudonymized genomic data is covered by the data protection regulation, which is a whole nother question, but I think there is potentially a responsibility to give data to data subjects in that situation.
Yeah, and this is also being considered like what do we need to give, what can we give, how to sort of how to be a service, but how to also sort of be promoting like public health and good uses of the knowledge. So it's something still very much debated.
Yeah, it's something I'm from the Sanger Institute, and it's something we're debating as well. So.
Yeah.
Thank you. I know Isabel has another question. Oops, sorry, there you go.
I'm just curious. You said that the Genome Center was not much debated for the time being in Finland, but are patient organizations or patient groups involved in the discussion somehow?
We've been trying to sort of I've been sort of a part of this communication group in this whole working group, and we've been trying to sort of activate people to generate also some discussion. And it seems to me that only people who are somehow active in this, because it's quite difficult to talk about this, are patients. And patients do have very much ideas, both concerns, but in relation to the sort of proper uses of the data. But I would say that patients, organizations, and activists are the ones who are somehow taking stance. But the problem still is that because this is a work in progress, it's quite difficult to have like very good information because the working group does not have the solutions yet. So I would say that is part of the problem why for example, the Genome Centre is not debated yet.
Okay. Thank you. I know Kazuto also has another question. You're unmuted now, Kazuto.
Thank you. This time simple. So the focus group research is interesting and important. So have you done it with the patient, particularly rare disease patient groups? They often say it's okay to use the data for commercial purposes.
Yeah. This one I left out from this study, the patients. I've done previous research among patients, and so the idea is also to sort of do later with some patient research. But my previous research shows that very much patients are more willing and eager to give their data to be used for their own illness, for people with the same illness and even other illnesses. But also they see have the similar conception of risks, but they are more willing to accept the risks than people who are not yet or do not consider themselves as being patients or sick.
Thank you.
Fantastic. And also, I know Barbara has a question, and Miranda Morby from Helix also has a question if we have time. We have 8 minutes left. Sorry, Barbara, I am just trying to unmute you. There you go.
I'm happy to wait if other people want to go first.
Oh, thank you. Miranda, would you like to go ahead? Let me just mute you. Oh, yeah, you're unmuted. Go ahead.
Excellent. Okay. I take it you can hear me.
Yes.
Yes. No, just very briefly, just because there have been a couple of comments about the general data protection regulation. Just on the point about the right to data portability, it's a technical point, but it depends on what ground you're processing the data. I think back at the beginning of the period of questions, we had a question about whether you need to process personal data on the basis of consent under the GDPR, and as Carolina explained, you know, there are a number of grounds on which data could be processed under the GDPR. One of which, as she says, is the public interest task. So if you are processing on the ground of a public interest task, then the right to data portability doesn't apply. It only applies if you are processing based on consent or on a contract, or if the processing is carried out by automated means. And I would assume that most research processing wouldn't be automated. So I don't know if that provides any reassurance, but that would be one right at least, that as long as you're processing on public interest as opposed to consent, that wouldn't apply.
And this is a very important point, because as I explained, there will be different routes for gathering the genomic information. So some people would actually have consented on it, so they would have the right for portability, and those who have been, whose data has been generated in the healthcare sector would not have the right for portability, for example.
Yes, I mean, you can collect consent from someone just for the purposes of good practice, for the social engagement, social license, but still process the data on a different ground, just for the purposes of data protection. So you could sort of compromise by obtaining consent or notifying, but still processing the data under a public interest basis, just because, as has been flagged, it is complicated to process data on the basis of consent under the GDPR, because the requirements are very strict and very technical. There has to be an appropriate balance of power, and I think the view in the UK is that, for example, where data are taken by a healthcare provider, there wouldn't be an appropriate balance of power between a doctor and a patient for them to obtain valid consent from a GDPR perspective. So I think the where we've got to in the UK at the moment is, as you say, there are a number of reasons to process on the basis of public interest, even where you've had to obtain consent for the purposes of confidentiality. And I think that's the consensus that we're working with as we're developing our data protection bill at the moment. So I just thought I would throw that in there.
Yeah. Imogen is saying something.
Imogen, we don't hear you.
Thank you, Kazuto. Sorry, Serena from the Sanger Centre, did you have a comment you wanted to make on that?
No, I was actually just, I think the last person actually covered it in the end, but I was just going to say that just because you have consent with GDPR does not mean you've actually met the threshold for consent under GDPR. So I think that is exactly the point, that it's really important to understand with GDPR that you may well, for many reasons, want to still take consent. However, that is not your legal basis for processing data under the GDPR. And I think it's very good, and the point about the data subject rights is a very good reason why you might want to consider not using consent as your legal basis, because you really do need to consider what would happen if someone withdraws consent from, are you able to handle that, and also what will impact will it have on your research if they're withdrawing consent.
Thank you. Sorry.
Yes, comment. And this has been really, like, the interpretations of some has been in Finland that you cannot have if you use the public interest as the reason to process data, then you cannot have a consent, because it would be like conflicting in it, and this is something that has been suggested.
Yeah, in the UK, the Health Research Authority is taking the line that you would need to still have consent.
Yeah.
Because for common law reasons. So we have the common law, and then so even though you still need to take that consent, but you won't be reaching the bar of GDPR consent. And so it's this horrible mess of understanding the difference between consent and consent. So
yeah, that is very complicated. It's difficult to understand, and for with the Finnish case, because there are so many overlapping systems and regulatory changes going on, biobank law and everything. It's like, I do not follow.
Fantastic. I can see that the chat is open, but I can't see the new chat. But are there any other? Oh wait, sorry. Let me just go to that. There's another one in there. I'm not receiving any new chat, so I'm not quite sure why that is. Apologies if you're asking me to get you involved. But Barbara, I know, had a final question. We are now down to our last minute, I'm afraid. But
no, exactly. We are down to our last minute, as you were saying, Imogen. And actually, my question was more or less answered by this very, very helpful exchange about the GDPR and the grounds for processing, which I guess we could continue discussing for another hour at least, if not another day. So my final question for Carolina, after thanking her for her presentation and for answering our questions, would be, Carolina, will there be anything published on? So if we're interested in following the developments in Finland, where should we look?
Hopefully there will be something published, a couple of manuscripts being submitted and in process, working both with the focus groups, but also with the sort of general developments in Finland. So I would, as they will be published, I could sort of give you of what's going to happen, so you can distribute it in the list.
That would be great. Thank you very much, and thank you for everyone who was here.
Thank you.
Yeah, fantastic turnout. Thank you.
Thank you.
Thank you very much. I will edit and publish, put onto our website, and let everyone know when it's available for distribution.
Okay.
Thank you very much, Carolina. Thank you.
Thanks, everyone, and have a good rest of the day.
Thank you.
Bye.
Bye.